All right, and we are live. Very good. Thanks for joining us. This is Dr. Sarah Merritt from Lifestream Health Center in Bowie, Maryland, here live with Dr. Amanda Adkins. Dr. Adkins is an expert in lifestyle medicine and plant-based diet. I would share that, in fact, I personally have done one of her programs where she actually does and I'll let her speak about it. She actually does a 5-day plant-based vegan challenge. If you haven't done it before, I think it's a great thing. And actually, before we just went live, we were discussing briefly the medical evidence that that this is a type of diet that can really give people meaningful health benefits. So I want to put this out here for my patients and for anybody who wants to learn more, because I think that while it seems like maybe a heavy lift sometimes to think about adopting this type of behavior, it can make a huge change for people, right?
Yes, yes.
Yeah, tell us more.
Well, thank you so much for having me, first of all. And I'm excited to talk about plant-based nutrition. People always wonder, how in the world did I get here? So I'm just going to briefly tell you like a synopsis of how I got here. So I was an overweight teenager, had high blood pressure, diabetes, cancer in my family. And just looking at the way my family was dying from different illnesses, and me myself being overweight, saw that that's the route I was going to go down, decided I needed to do something different. So actually, as a teenager, I started exercising, lost a lot of weight. And then, as you know, in med school, we don't learn a lot about nutrition. And I happened to go to a nutrition conference just because we had to do CMEs and all that kind of stuff. I'm in Arizona, and there was a doctor there that said you cannot out exercise a bad diet. And I was like, I've been trying to do that my whole life, I think.
Right.
But I did become a vegetarian at the age of 16, but I tell people I was a junk food vegetarian. So it wasn't that healthy. And then I actually, a patient told me about Dr. Joel Furman. And then I learned more about plant-based nutrition, then studied to be board certified in lifestyle medicine, which just happened in December. So I'm so happy with that.
Congratulations.
But yeah, and then I had a lot of patients asking about that. So it was actually my own health and wellness journey that actually got me here today and to discuss plant-based nutrition with you. So it's not just something I talk to people about. It's something I actually practice myself. So a lot of patients like to know that.
How long have you been plant-based yourself?
So purely plant-based, probably be, I would say, 5 or 6 years now. Because like I said, I'm vegetarian since 16. So I did that for over 20 something years. And then I cut out all animal-based products probably about 5 or 6 years ago.
And
I always lose track now, but yeah.
Is plant-based and vegan the same thing? Let's talk about the nuances of some of these names. What does that mean to say that you're plant-based?
Yes. So for me, I use them interchangeable. For other people, they really have a strong call to veganism, which is more than just the eating style. It's actually their whole lifestyle. They're really big on animal rights. So that goes with clothing and, products, all sorts of things that veganism may entail. But when we talk about just the way you eat, then it can be interchangeable. But also, I like to focus on that there's a difference between plant-based and whole food plant-based.
Tell me about that, because I don't think I know that difference, honestly.
Yeah. So, the marketing industry has really been pulling plant-based. They're like, oh, you can have your plant-based ice cream. You can have your plant-based donuts, all these types of things. And so I usually like to emphasize to patients and, just a general audience that those are not the type of plant-based foods that actually help with health. They may not have the animal-based products there, but they're still very highly processed. They're still high in sugar. And I always tell people I'm not a hypocrite. I do sometimes take it, eat those foods. just not on a regular basis. So if it's something, birthday party or something special, then I probably would have some, plant-based ice cream, something like that. But the health benefits coming from eating the whole food. So if you can look at the food and know what it is and know that it hasn't been through a factory, then that's where you're really going to get the benefit of eating plant-based.
Yeah, so I think I personally have purchased Ben and Jerry's makes a plant-based mint chocolate ice cream. It was delicious. But was it Whole Foods? Probably not. I mean, I'd have to look at the label, and it's probably not even the worst label out there, but it's more than there are a variety of ingredients and the processing, right?
And the sugar.
And the sugar.
The sugar, yes. I tell people, I was like, that's the big thing, especially since we're talking pain even later. So sugar and salt, that's how the food gets us, because that's what our brain wants, is that sugar and salt. And it's really high in those processed foods and how they can get us coming back for more.
Yes. Yeah. And I think, so I'm familiar with the idea that sugar is habit forming. And there's some research on this, right? With rats, to my understanding, where you can show that, a diet that's sugar supplemented tends to reinforce repeat feeding, overfeeding, et cetera. And maybe we're seeing that ourselves in our society as Americans, where we have a high sugar diet leading to some adverse outcomes.
Yes, that's so true. In the program I do, I usually focus people on, oh my gosh, his name is leaving me, but it's called the pleasure trap. Because most time people would say, like when you think of sugar, they're like, oh, especially for diabetics, oh, I can't eat fruit because it has sugar in there. And I'm like, oh, those two are two different types of sugar, and if we think about sugar that like comes from ice cream, it's to our palate, it causes us to have like an overreaction to the sugar. And then when we eat like a piece of fruit, we think, oh, it's not ripe enough, if we actually get ripe fruit, because it doesn't taste as sweet. And that's because we're used to tasting food that is so hyper and so manufactured, so much more sweeter, that it will actually, like I said, cause us to have that addiction and to continue to come back to that those sugary foods.
And I think some of that's that concept of added sugar, right?
Yes,
versus something that has a natural sugar in it. That's
exactly
a fruit or a naturally sweet substance of some sort.
Yes.
So how might so a lot of my patients suffer with pain issues. Why does sugar intake matter for somebody with pain?
So inflammation is big. So usually we think about, like, even for not just pain, but other underlying medical illnesses, is mostly due to inflammation, and sugar just kind of makes that inflammation worse. So that's why we want to definitely try to cut that, along with like saturated fats. So if we can cut that and decrease the inflammation in our body, because almost everything that we eat, especially the things that are overly processed, has our body in a reaction mode. It's like a low grade inflammation, as always. So of course, like when you scratch yourself or hurt yourself, something like that, there's an inflammatory response. But it's when we eat foods that are highly inflammatory, it's like this low like inflammation that just continues to go on, and your body is like, oh my gosh, just something that just like, what I think, water going over a rock. Like, it's just like, it won't injure the rock initially, but it just continues to go over it,
over time.
Yes. And so therefore it causes damage. So we want to try to get rid of that low grade inflammation, and therefore would definitely help decrease our pain. And that's why.
Do we have good measures of that kind of low grade inflammation? That's one of the things that I've kind of struggled with, to make it real to patients, and certainly sometimes patients will even tell me like, oh, I feel so inflamed. And, how do we measure that? Are there ways? How can we help show that to patients?
So sometimes in blood tests with our like high sensitivity C-reactive protein level, that could actually be shown. But I mean, in an everyday practice, that's the only one I know of. It's not really that you can go and say, oh, go
Yeah.
to this and look at your arteries, which they have done studies on that actually shows how the artery changes it just with certain meals. Like just after one meal, you can see how that changes. But usually high sensitivity C-reactive protein is what I would check in a patient and show that they have that inflammation that's there. Or, I mean, also insulin resistance.
Hmm.
People have that. That could be one that you can do like a fasting insulin level. Of course, if your glucose is going higher, I mean, these are underlying things that you're like, oh, you probably have inflammation that's going on there. But before those things actually come about, the C-reactive protein may be high.
Very good. Yeah, and for sure, yeah, we've measured that at times in patients too, and I'm just curious if there was more to it, because I know, while I think that is a real thing, that is one of the challenges, is how do we show it, and
Yeah,
we know it's there.
yeah. That's why I like doing, like you talked about, my 5-day cleanse, is that people when they do that, they actually feel so much better and lighter. And I was like,
Hmm.
okay, just seeing the difference and feeling the difference, because like I said, it can be overwhelming at initially. Like I said, that book, How Not to Die, is like this thick, and so somebody
Hmm.
will look at that and like, oh my gosh, there's no way I'm going to read through this. But just taking 5 days out of your busy schedule and seeing how much better you feel
Hmm.
usually is eye-opening to patients, for them actually is like, okay, maybe I can do this. And
Yeah.
it's not something you have to be 100% perfect at all the time, but just going through that and like, oh, maybe I won't eat this burger. Instead, I'll eat a salad, or
Right.
some beans. Hmm.
Yeah. Yeah. And I think, especially, I think a lot of us have probably some meatless choices that are more natural or are already on our daily menus. So I
Hmm.
think, like, say, if I'm thinking about doing a 5-day program, a 5-day trial of a cleanse, um, really it might be a matter of using those recipes I already lean toward, and then adding maybe some new things or try something new during that time.
Yes. So it was eye opening when I started doing the cleanse of having other people do it. And they're like, they don't like certain things, but like you said, bring in what you like. And I usually try to tell people to focus differently on your plate, instead of like, if you're a big meat eater, most time we think of meat as the main dish. And if you just like put the meat as a side dish instead of your vegetables being the side, that's
Yeah.
a huge difference. And so when people feel overwhelmed, I usually have them start there, and just fill their plate with more plants, and then the meat is a little bit on the side. And they
Yeah.
usually feel like they can do that more than if I just take it all away. And unless they ask me, well, I don't want to be on medicines at all. I'm like, well, then the meat
Yeah.
has to go.
Right. Yeah. Yeah. It might take you a minute to get there.
Yeah, yeah.
Yeah. That's great. Yeah. And can you share a little bit on that? I mean, have you worked with people who have been able to, you're a physician, you're a prescriber, you can prescribe medications, but have you been able to work with patients who've been able to stop medications? If you could share like maybe an anecdote or a win, some patient that was able to have some success, I think that can be really inspiring.
Yes, yes. So one was a lady that really like inspired me. She actually was coming in and was like pretty healthy, but always kind of like borderline with the numbers. And
Mhm.
one day she came in, I'm like, ooh, it looks like now you're actually a diabetic. And her eyes just kind of like, oh, because most of the
Oh,
time people, when they hear like pre-diabetes or your fasting sugar is a little bit high, they're like, oh, well, I'm not at diabetes yet, so it doesn't really matter. But for her, she saw like her family members doing shots and all that kind of stuff, and we actually talked through her nutrition and exercise, so like all the different lifestyle things. And 3 months later, she came back and was totally back to normal glucose and everything. She was like, I'm not doing the medicine thing, I'm not doing
mhm.
shots. And so it just takes that, sometimes for people to feel that deep within. Like I said, for myself too, and for this young lady here, she was just like, I've seen what it does to people, and I just don't want to go there. And that deeper conviction definitely helps them, because
Yes.
when it's just like, oh well, it's hard to actually talk people through it when they already feel defeated. So I try to give them hope, to show them that it actually can be done.
Yes.
But
But if you're diabetic, you could reverse that. If you were
yes,
hypertensive, you could reverse that.
definitely reversible, and they could see it easier because they could actually check their blood sugar numbers on a daily basis or even more often and see how the food actually affects. And they're like, oh my gosh, it actually is a lot better.
Yes.
But she always sticks out in my mind because it was like so like a whole 180 change. She was like, I'm not going there. Here I am. I'm going back.
Wow.
Yeah, unfortunately, like I moved from that practice, so I don't know how she's doing now, but she was one that I will always remember that
Yes.
keeps me inspired to keep, telling people about it.
That's right. Well, and I think talk to me a little about how this interfaces with weight. I mean, weight is one aspect, but I think what's interesting and appealing to me about this type of diet plan that it's not about what you look like or about the number on the scale, right? It's more like about the process and like what's going in your body. And like to me, that's really appealing because we're not trying to achieve some cosmetic outcome or, oh, you got to lose XYZ. It's
Right.
really more about, hey, here's the healthy stuff. Let's focus on doing the healthy stuff. And then our body's going to be in a better place.
Yes, yes. So I'm glad you mentioned that because for me initially it was the weight loss because I was overweight, but it was like, but I don't want those illnesses that come with the weight, right?
Yeah, that's right.
So when people actually feel better, they're not on medication and they're not like diagnosed with certain things, and that's when they're like, okay, now I understand why I'll choose, eating beans and Brussels sprouts over a hamburger and fries because one, they're not going to end up with, well, I shouldn't say not, very low likelihood that they will end up with a heart attack or stroke, cancer, dementia, all these things. And when you actually tell them those benefits and they think long term, they're like, okay, you're right. I definitely don't want those things to occur because plant-based nutrition has been shown to actually help decrease those things. Like I said, inflammation, and it's vascular related also for a lot of those illnesses, especially in the top 10 for the US. So when you actually look at it that way, also when people talk about costs, I always try to throw that in there too, because they're like, oh, eating healthy costs too much. And I'm like,
Yes.
oh, but if you think about it, I always use my like 20-year-old versus my like 70 or 80-year-old. So you had this the same body that you're carrying through those decades. But most time people are like, well, oh my gosh, all of a sudden I was diabetic. All of a sudden I had high blood pressure. And I'm like, it's not all of a sudden. Those decades of what you were doing to your body built up. And now they're showing up. They're telling on you of what you did all those years ago. And now it's going to cost you a lot more, not only in the way you feel, but in medications, in doctor's visits, in insurance costs, in opportunities to do all these other things that people don't actually calculate in money, like being able to travel. Like I want to be able to travel all over the world when I'm 90 years old, walking up these flights of stairs, in the ruins of, Egypt and all that kind of stuff. So I tell people to look at that. Like, do you want to do those things when you're 60, 70, 80 years old and not be like, oh my gosh, my knees, my back, my ankles, I can't do that. These are the things that you need to be looking at now to be able to help you to do those things when later on. And even if you're at that point, you can, still, trace back to where you can reverse some of those things, maybe not fully, but you can reverse it to where at least you're able to move around a bit more and not be in pain all the time.
Right. Yeah, I think that's super interesting. I think you're right. There is the cost discussion that could be like a whole show too about all the unappreciated costs of conventional medical care versus maybe spending on your diet. And then I agree to your point. Whole foods plant-based diet doesn't have to be more expensive. It might be if you had a lot of prepared options, but if you were willing to do some food prep, I think you could do very well in terms of cost.
Yes. And again, even if you pay for the food prep to be done, which they have a lot of, I'm looking into this more plant-based meal prep options, or like those meal delivery services that they actually get all those things prepared for you. So if you're not a cook, then you can have those delivered. You just, pay for the services that you would just paying, those fast food companies. You
Right.
can do the same thing.
Right.
I mean, so.
Right. Just
And then not
requires
have
a little
to
extra
calculate it.
planning and
Mhm.
and really kind of being intentional.
Yes,
I mean, it's really
exactly.
self-care, right?
Exactly. That's it.
I
That's
think
it.
so. Yeah. Um, that's great. I was going to make reference here to How Not to Die in the comments, just because that was a book that came up, and yeah, there are others certainly, and I'm glad to take any other recommendations and books that you recommend.
Yeah, I'm gonna pull this one out because I shout out Dr. Joel Furman. One of the first books I got when I was younger, Eat to
Okay.
Live, and this is one of his older books, but I still keep this because it was, like I said, my patient when I first started practice, before I actually started my own plant-based journey. He told me about that, and I just use that as a reference. And like I said, it's on my desk now because I was reading through it again, giving more tips to give out to people in my clinic and everything. So love Dr. Michael Greger and Dr. Joel Furman and their books. They're two big ones that I follow.
Very good. And so if a patient were thinking this sounds interesting, um, you know, it sounds like you work with people, and tell us about your practice. Tell us about how you help people think about adding whole foods, plant-based diet to part of their plan.
Yeah, so I work as a primary care physician in Fairfield, California. So anyone that comes to see me there, they always know that when they're coming in, I'm going to ask them about their nutrition
Mhm.
and kind of tailor it to what they're looking for and what their medical issues are at that point in time. I'm always going to tell you to add in more fruits and vegetables. I'm always going to tell you to exercise, and we're going to see where we can tweak that. But then for people that aren't in the Fairfield area, I do also work as a health coach, and I work with people all over the U.S., helping them to actually transition to. Most of them do a plant predominant diet. They're not 100% plant based. Most people are more open to that. And I was like, I can definitely do that because there is research that shows the more you go along the spectrum towards being plant based, you do get some of the health benefits along the way. So definitely encourage people to do that. And we
I
start
like
out with
that
that 5 day
concept, just the
cleanse.
idea that any change is positive, right?
Yes, exactly. Exactly.
Yeah. And so you can help people just make those little nudges, even if they're not ready for a full-time whole foods plant-based. Try it for a few
Yeah,
days, try it for some meals, and see what differences.
exactly. Because
Yeah.
that was my journey. Like I said, it's been 3 decades now that I've been practicing these things to continue to adjust and to get to that point to get the maximum benefit that I can.
Awesome. Well, thank you so much. I've shared your links in the comments for your website and your Instagram, and I'd love to connect again and maybe dive a little deeper on how patients can incorporate some of these things. But I just love it. I think it's so important, and I really would love to help folks consider, what leaning a little more plant-based could look like in their own life.
Yes, yes. Definitely love it. And people are more and more open to it. So I'll be more than happy to come back and talk more.
Thank you. Awesome. All right. Thank you so much, Dr. Amanda Adkins, for being with us today.
Thank you.
Take care.
Bye.